My name is Chris Finley, General and Bariatric Surgery with HCA Florida Faucet Surgical Specialist. The general patients that come into our practice are either a lot of weight loss patients, both surgical and medical, heartburn patients, so people who've been suffering from heartburn for their whole life or have hiatal hernia or trouble swallowing or stomach problems, patients that have GI-related issues of all different types, from routine colonoscopies to chronic GI pain and chronic GI problems. A lot of hernia patients. We are seeing a lot of hernia patients, and with the robotic technology, we can get stuff done that was never even imaginable before, and doing it through a minimally invasive techniques. When we say robotic surgery, it's really just robotic assisted minimally invasive surgery. So it's not the robot's not doing the surgery. It's doing it through the same kind of minimally invasive techniques that we've done laparoscopically with a couple small incisions, filling the abdomen with gas and going in with a camera and the little instruments. But we hook the robot up to it so we just can have a lot more abilities with it. I liked to get to the root cause and fix stuff, and so someone comes with a problem, you fix the problem, their problem's gone, next problem. And what I really found about bariatrics is that was the root cause of so many patients' health issues, and not only physical but also mental and emotional. So when you really treat a patient, bariatrics, and they lose that significant amount of weight, that weight has an effect on every single organ system in the body. So when you treat that, every single organ system in the body improves.